Hi there, I'm Wattanak, your host today. Welcome back to the Tevi podcast. This is episode 2. Let me ask you something. Have you ever thought about how risky it still is for women in some country, include your own, to give birth? We often celebrate a new life, right? But sometimes pregnancy and childbirth can be life-threatening. Today, I want to talk about maternal health. That a big global goal by the year 2030, we want to reduce maternal death to fewer than 70 per 100,000 live births. That's a part of the Sustainable Development Goal. But the question is, will we really reach it? Let's explore together. So, first, the global situation. I want to share. Every day, around 800 women die from pregnancy and childbirth complications. Most of these deaths are preventable. That's the sad part, right? The main causes are usually things like severe bleeding, infection, high blood pressure, or unsafe abortion. If health systems are strong, this problem can be treated. But in many countries, especially in Africa or South Asia, women do not always get timely care. Now, the good news, compared to the 1990s, the world has made progress. Maternal death has gone down. But in the recent year, progress has slowed, partly because of COVID-19, but also because of inequality in health system. So, reaching the target of 70 by 2030 globally is a strong challenge. Now, let's bring it closer to Cambodia. Back to 2000, our maternal mortality rate was very high, about 900 women per 100,000 live births. Imagine that, almost 1 in every 100 mother. But here, the progress. By 2014, it dropped to about 170 and now about 154. That's a huge achievement in just 2 decades. Still, 154 is more than double of global target. So while we should be proud, we also need to be realistic. It's not enough. What makes it hard? Well, a few things here. Women in rural areas still live far from health center. Not every delivery is attended by the skilled birth attendant. Nurse, midwife, or doctor have to be trained. Emergency care like surgery or blood transfusion isn't always available quickly, and poverty, culture, and education all play a role in whether women even take care in time. At the same time, Cambodia has made a big stride. More health center, more trained midwife, more mother going to ANC. So it's not all negative, but the gap is still wide. Let me share a reflection. When I worked in healthcare, I saw a case where delay made the difference between life and death. Sometimes it was just a couple of hours, waiting for a family to make a decision, finding transport, or reaching to the hospital. That is what researchers call the 3 delay model. Firstly, delay in deciding to seek care. Second, delay in reaching care. And thirdly, delay in receiving care at the facility. And you know what? Every mother that tells us something about our society. It's not just about health. is about inequality. Women in the rural area, poor family, or those who less power to make the decision are at a higher risk. So maternal health it isn't just a medical issue. It's also social, economic, and even political. So can Cambodia reach the target of 70 by 2030? Honestly, it's going to be really difficult. The progress we made is good, but to cut the number in half again, it's just a few years that ambitious. But there's what is possible. We can strengthen rural health center, right? We can make sure nurse, midwife, or doctor are well trained and supported. We can improve emergency system, ambulance, blood supply, referral hospital, and maybe most importantly, we can empower women so they have the right to make the decision and access care without any problem. Even if we don't fully reach the goal in 2030, every step forward matters. Saving one life, preventing one death, right? That's already a huge impact. Maternal health has improved a lot in Cambodia, but the challenge still remains. The global target is 70 by 2030, and while we might not get there fully, we can still make a big progress. And remember, behind every statistic is a real mother, a family, a sister, and a community. This is about more than number. It's about people, right? Thank you so much for listening to today's episode. I hope this episode you love it, and I promise see you the next episode. Thank you again. Goodbye.